everyone. Welcome to our podcast. I'm your host, Dr. Harshita, and we are privileged to have with us Dr. Ravindar Bajaj, a highly experienced consultant pediatrician with an impressive 39 years of experience. Dr. Bajaj has a rich background, starting his career in 1984 with UNICEF as a special medical officer, leading the pilot program of universal immunization in Delhi. He later served as a pediatrician in Indian Railway Medical Services as a Class 1 medical officer for almost 13 years. And Dr. Bajaj's commitment to learning is evident through his recent achievements of a certificate course in CBRNE from Indira Gandhi National Open University. Dr. Ravindar, it's truly a pleasure to have you here with us today.
Thank you very much, Dr. Harshita. It's a pleasure to be on this forum and to share my thoughts with all the viewers.
Thank you, Doctor. So let's begin our discussion on the topic neonatal and infant feeding. So, understanding the significance of the first R in neonatal feeding is crucial, especially in establishing healthy feeding pattern. So, Dr. Bajaj, could you share your insights on how critical the first hour of life is for neonates in terms of initiating feeding?
It's very important for the mother to start the feeding as early as possible. There are many aspects associated with the early feeding. It induces the reflex and it soothes down the mother and it results in infant and mother bonding. The mother also gets benefit and the child also gets benefit. The healing of the wounds associated with the delivery also heal faster, and as soon as the mother puts the child to the breast, the child feels calm and suckling reflex starts, which induces the breast milk, and that helps in further weight gain and also helps in emotional bonding with the child. So the first hour after birth, as soon as the child is born, the child should be put to the breast for the suckling reflex to initiate.
And now, Doctor, maternal nutrition plays a vital role in breastfeeding. So, how does maternal nutrition impact breastfeeding and the health of breastfeeding infant?
It's very important for the mother to follow the instructions which has been given to her during the antenatal period. The good nutrition during the antenatal period will lead to a good birth weight of the child, and in case the mother is anemic, and the further anemia will develop in the mother, and milk secretion even during the post neonatal period will not be as much as the required by the child. So the first thing the mother needs in education during the antenatal period regarding her own nutrition, and she should be sensitized to the breastfeeding as soon as the child is born. Mother is normally prescribed iron, calcium and other vitamins, and the regular checkup and it is being done by the gynecologist. They always take the weight gain of the mother also to see whether the child inside the womb is developing normally and the mother is gaining weight. So at the time of birth, less of the problems and a good healthy child is born.
And what measures should be taken to ensure the adequacy of breast milk?
The first thing is most of the myths are associated with the breastfeeding regarding the inadequacy. In my 39 years of experience, I have observed not more than 30 to 40% of the mothers are breastfeeding the child exclusively, which is the norm. As far as the Government of India, WHO, American Academy of Pediatrics, Indian Academy of Pediatrics, they all emphasize on breastfeeding. There is nothing as compared to the breastfeeding. Now, most of the mothers feel that the breast milk is not adequate. So there are few signs which probably needs to be told to the mother so that she feels confident and happy to breastfeed the child. One of the important factors that I have observed is the crying in the neonate and the infants is always interpreted as the inadequacy of breast milk. The fact of the matter is there is only one scientific parameter, and that is the weight gain of the child. And the mother should remember that in the first 10 days, the child will not gain weight. Initially, for 3 to 4 days, child is going to lose weight because of extra water in the child. So that should not be interpreted as the inadequacy of the breast milk. After 10 days, the weight gain is going to start. So even if the child is losing weight in the first 10 days of life, mother should be reassured that mother milk is adequate. She should continue with her nutrition, and after 15-20 days they should again measure the weight of the child, or they should consult the pediatrician who can reassure. During this period, the mother should take adequate diet. There is nothing contraindicated during the delivery period. And apart from the mother, the more caregiver, especially in the rural areas, the mother-in-law, the father-in-law, they should also be sensitized that exclusive breastfeeding is good for the mother and the child. There are other indicators which help us to determine whether the breast milk is adequate or not. Number one, if the child is satisfied while taking the breastfeed and child will sleep for a few minutes or few hours, that shows adequacy of the breast milk. The second part is if the child is passing adequate urine, say at least 5 to 6 times in 24 hours or more than that, that also shows adequacy of breast milk. The third point is, as I have already told you, this is the weight gain. Another factor which probably leads to confusion in the mother is excessive crying. But the doctor should assure the mother, and also the caregiver should assure the mother that crying should not be associated with the inadequacy of the breast milk. Sometimes the child needs mother and not the milk. At times it happens when the child puts the child to the breast, the child calms down. The moment the child is removed from the breast, child starts crying. So the difference is when the child is hungry, child is going to suck very fast, and the mother knows the child is taking adequate milk. Sometimes it is only a closing to the mother, that once the child is putting to the other, child knows that mother is with her, and child calms down and will not take milk but will sleep comfortably. So these 2 points should be emphasized in the mother so that she feels confident, because the mother milk is associated with psychological reasons also. A happy mother, a tense-free mother will have enough of the milk to breastfeed the child. And as soon as the child is growing, the milk is also going to increase. So they should not feel like that the milk will decrease later on, the child will not accept a bottle, which is the main misconception. And the child from the very first day or after few days it put to the bottle, which is wrong practice. The more the mother puts the child to the breast, the more milk is secreted. These are the messages which I want to give to all the prospective mothers and to all the doctors also, so that we help in establishing 100% breastfeeding in India at least.
Now, feeding preterm infants requires specialized care. So, could you share how you approach feeding strategies for preterm infants and what are the considerations for it?
Especially the preterm children, they need more of proteins. That is one of the thing. But the thing is, if the child is delivered at home, even if the child is premature and the child is able to breastfeed, there is nothing wrong with it. And the mother's milk will gradually increase. The only few supplementation the child will be needing is good nutrition by the mother, and few vitamins which the child will be needing, like vitamin D, iron and calcium, which will be required in the preterm way. But unless and until the child is hospitalized in the hospital, where the child is too premature and not able to suckle from the breast, then only the special consideration that has to be determined by the pediatrician, because the calorie requirement to premature child will be around 150 to 170 ml. But again, the preference here will remain the breast milk. Even in nursery, if the child is not able to suckle from the breast, it's the expressed breast milk which is preferred to the given to the child. And whether they give it through the infant feeding tube, which is the norm during in the nursery, and the breast milk mother has to give it, there are very few instances where the mother milk will not be adequate, and then we have to supplement with that. So few vitamins which probably are needed in premature child, and few minerals which the doctor will tell, and that has to be supplemented. But premature child has to be fed early because of the risks of hypoglycemia, low blood sugar that happens, and then the calcium phosphorus ratio, that is also very important, which the child needs, and that the pediatrician will determine whether the child is getting all those vitamins at the regular intervals. Even if the child is born at home and the mother is going to the pediatrician, these parameters should be checked, and again the weight gain will help us determine the further course of action. So these are the premature things which probably are needed for the premature child, and which are to be taken into the consideration.
Yeah, and in situations where infants are not gaining weight as expected, so how do you investigate and address potential feeding related issues, and what kind of guidance do you provide to parents?
Again, the same situation arises when the mother is asked about the weight gain of the child, and you should see whether the mother is not anxious, mother is getting support from the parents, from the caregivers, from the husband to provide the breast milk, and if the child is not gaining weight, whether the child is getting enough of the vitamins and the minerals. It's not only the single reading which is going to determine whether the child is gaining weight or not. Again, the parameters which I have suggested regarding the adequacy, frequency of micturition, and the developmental part of the child, few of the early signs which help us. And in case the child is not gaining still weight, you have to physically examine, and in case there are no congenital abnormalities, the child is sucking well, we can reassure again the mother. But it's only very few cases where the supplementation will be needed, and in case it is required, the child gets tired early, especially in the premature child. The express milk, which now is breast banking, is also being preferred, and the supplementary feeding can be given by the mother or any caregiver. When the express milk can be stored even for 6 hours at the normal room temperature, and even if it is refrigerated, more milk will be available, and that can be just warmed and then given to the child, either with the spoon feeding or with the very high precautions taking with the bottle feeding. So even if the child is not gaining weight and you have to supplement the feed, make it sure the first the child is put to the breast. Once the child has taken milk from both the breasts, if you still find the child is hungry and crying, then express milk or any other supplementary feeding can be given. But before that, these parameters are very important to check for the child, because premature kids and low birth weight kids and the kids who are not getting enough of the milk are more prone to get infection, and the developmental problems are going to come.
Yeah. And now, doctor, moving ahead, determining when an infant is ready for complementary feeding is an important milestone. So, what indicators suggest that an infant is ready for complementary feeding?
Most of the time, what the dictum has been, the complementary feeding is to be started at 6 months of age. That is as per the WHO, Indian Academy of Pediatrics, and by the Mother and Child Health Program initiated by the Government of India. The only thing that has to be done is whether the complementary feeding, how it is to be prepared, and the early sign where you see the child will be able to take it after even 4 months of age. But 6 months is adequate because when the breast milk is there and the child is gaining adequate weight, and you will find the child has got a more of biting tendency at 6 months of age. And once you given, even if the few semi-solid things, the child will be opening the mouth and even show the expression that he wants more and more of that particular. So 6 months is the best time when you have Indian traditional cultural foods. It depends again on where the cultural meals are there, but it has to be prepared hygienically. And at that time, 6 month old child can hold his neck and is ready to take even with the spoon. In few of the cases, you will find a extrusion reflex strong even at 6 months of age. When you are giving something semi-solid to the child, sometimes it comes out, but that should not be taken that the child is not taking it. It's an extrusion reflex, which is only in very few of the cases it happens. But once you continue to feed, and the child will start accepting it and will be able to digest it. Now there are few again misconceptions whether we should give sugar, where should give salt, or where should not be given. I will just leave it to the cultural things, but breastfeeding has to be continued and gradually 1 or 2 feeds per day with the semi-solid food. And in case gradually, once the weight gain is starting, you can continue to increase the semi-solid feed, but breast milk has to be continued as long as possible. But here now, with the advancement, mothers are working, they are going to work, and it is happening in most of the cases they don't want to take risk and they introduce the bottle. Here a message to those mothers, I will say, in such cases, as I have already told, the express milk is there, and government of India has provided facility for 6 months leave for the mothers to have it in case they are working in any sector, whether it's a government sector or in a private sector, so that the mother can continue to breastfeed the child. So any employer is also supposed to give leave to the mother so that it's 24 hours the mother is available to feed the child. And later on, once the complementary feeding has started, mother will also get a little bit of relief in that sense that she can continue to do it. And here I will again emphasize one point, because for the working mothers, they put the child to the powdered milk as early as possible, because sometimes it's forced on them to resume the duty early. Here again I will say, if that is the case, still instead of giving some formula milk or something, like early weaning can be advised even after the 4 months of age if the child has got a biting tendency, because the child will be able to hold the neck. 35 years back we were also giving this complementary feeding 4 months plus age, but the reason was poor unhygienic food preparation in the rural areas. That government advised that 6 months is the best period when the child has got more of immunity, more nutrition, more ability to digest the food. But once we start giving a semi-solid food, ensure it that you also have to supplement some water also, so that solute load on the kidney is not there. In that case, once you are giving semi-solid feeds, mother milk is also to be given. And in case some water is required, it should be either filtered water or a boiled water, which should be kept ready. In any case, bottle feeding should be avoided as early as possible. The reason I advise here bottle feeding contraindication is because once you start bottle, the child will prefer bottle and not the mother, because breastfeeding is an active process while the bottle feeding is a passive process. And once the child start accepting from the bottle, he will shy away from taking the breast milk. And gradually, if the mother is not able to breastfeed the child, the milk will dry up and daily the quantity is going to decrease, and you will find within 1 month the breast milk stops. So let's follow the nature. The more the child is fed from the breast, the more milk will be secreted.
And now, when faced with challenges such as breastfeeding aversion or difficulty in latching, how do you work with parents to troubleshoot and find solution?
There are very few cases where this aversion to breast milk because of certain reason, but I will still say the nature has provided so many things, and when the mother says something that the child is not taking vaccine, I will advise the caregiver to find the real reason for it. Sometimes it's anxiety which has been created in her. Sometimes in few of the mothers in the rural areas, they will say mother milk is not good because the child is passing stools 5 to 6 times a day, 8 times a day, and they always blame it with the nutrition what the mother is taking, or they will associate it with the child because child is not digesting milk. Here there are few points which is to be noted. Even in a normal child who is born, the frequency of motion may be 6 to 8 times even more if the child is exclusively breastfed. It's not a sign of infection and no antidiarrheal are need to be given. These in the our language we say it's the child is chirak raha hai. That means child is passing gas along with some amount of stool which is secreted. Because when the child is taking breast milk, sometimes the child is swallowing the air also. Now the pressure after the digestion, the gas is produced and the child has to pass it. So two things probably which happen is once the child is passing gas and the stool is passed, the mother think that it is a diarrhea because the frequency is going to be 7 to 8 times. In these cases also sometimes the child is regurgitating also and they consider it as vomiting and intolerance, while the reason is again the same. Once the valve opens to pass the gas like we do belching, thus sometimes the milk is also comes out. Again, if the child is gaining weight and as per the standard, at least 500 to 600 grams per month. Even if you calculate it is 15 to 20 grams per day if the child is gaining weight, and that can be determined easily even in the rural area without the help of a doctor, and mother can be reassured the weight gain is okay, you don't need anything. But in few of the cases, even just remember during the COVID time, we never stopped breast milk. So breast milk rather protected the child, and I think we all thank the nature, the God, the breast milk, that the less number of children suffered from COVID, and even those infants who were COVID positive, nothing happened to them, they came out, and probably that is the immunological things which the child gets from the mother's milk. Even in the HIV positive cases, where sometimes earlier we used to say that this breast milk should be avoided, but now the latest thing says if the mother is put on the antiretroviral drugs for HIV, she can continue to breastfeed the child. So that is the importance of breast milk. Now coming to again your question, in few of the cases if the child is not gaining weight and you have assured that mother's milk whatever it was there and the mother milk is not running, and if the child is more than 4 to 6 months, as I have told you, weaning foods will help us. Now weaning food preparation, that will again depend whether you add how much butter, how much ghee, how much. So practically once that you start feeding, gradually the child himself decides how much to eat, when to eat, how long to eat. It should not be forced on the child. Child determines. Once you feed the child, if the child likes a particular thing, child will continue to open the mouth, and once the child is satisfied, the child will close the mouth, and at that time don't force the child. Sometimes it is happening in many mothers also, because once we advise that child is not gaining weight, they get tense and they start forcibly feeding the child, which is again a wrong concept, and the child starts vomiting and then a problem starts. So reassurance, proper guidance, and the variety of foods, that is also very important. Many of the kids what we see, they will prefer a neutral, some will prefer a sweet things, some will prefer salty things. So if you are making preparation of different kinds, gradually the mother will know what particular thing the child likes, and that can be given for a few days. Later on again the variety, again go on trying the other types of food. And it's a very good practice when the mother is eating food and the child is in her lap, anything which the child can swallow and is being cooked at home, which is soft in nature, and the mother feels like that the child will be able to swallow it, that should be given to the child. So child is advised to take so many things, and child is also gets early tolerance to these foods, and the later on even the allergic things do not happen. So early introduction of foods will help in later development of the child.
Yeah, and doctor, as you have extensive experience, so what are some of the common misconceptions you frequently encounter in your practice?
Most of the time, as I was told you, even in the Western books, what I read is sugar is not to be given, salt is not to be given, dry fruits are not to be given. But here, again, here in India, we had been following the tradition of all those things, homemade food, the food which the child prefers, that helps. It I have even just seen it that if you don't give the sugar, but again we have to give sometimes the medicine which also contains sugar, sometimes the tonic also which being prescribed to the child, they are also getting sugar. So no contraindication of the sugar. Let it the child decide how much to eat, and most of the Indian preparations are good enough which contains as per the cultural tradition. They have got a salt or salt. Once you are yourself taking, give it to the child. If the child accepts it, likes it, child is going to demand more and more with his gestures, and with, as I told you, opening the mouth and taking the things. So don't deny the child, don't overfeed. Child knows how much to eat, and as soon as the child is satisfied, child will stop eating. So along with that, I will just say, if you are given a breastfeeding, most of the time another thing which I have observed is scheduled feeding, which is against the nature. It's required only if the child is on a top feeding. So no scheduled feeding is required. Child himself decides whether 3 hours, 4 hours or 2 hours. So at that time the child wakes up, mother can understand and differentiate between three different cries also, whether it's a hunger cry or it's a cry which is associated with the child has passed stool and wants attention to that, child has passed urine also and the diaper is wet. So these things should be considered. If the child is not satisfied after 2 3 hours and still crying, just check these 2 3 things if the child needs attention. And another thing is associated, the child is dying and mother doesn't know, but check it out if the diaper is okay or there are rashes developed in that which make the child cry more, and the mother is confused if the child is hungry. So these things also need to be considered along with the other factors which I have already emphasized. Hygienic food preparation, don't give leftover food to the child, make it as fresh as possible, feed the child, and whatever is left is not to be given to the child, that can be consumed by the other kids or by the parents or the any caregiver. So you cannot waste the food also. Later on I will just advise a few of the things instead, because most of the time what I have found is even after 6 months there are plenty of preparations in the market, which probably every mother knows, and they just available over the counter without any reason which the mother are buying. So these preparations which are cooked at home are fresh in vitamins, fresh in minerals, and what the mother is preparing is good quantity, nutritious quantity. So many things like in Indian tradition, suji kheer, sabudana kheer, suji halwa, atta halwa, the dal which is not very thick, moong chawal khichdi. So many preparations Indians are preparing and they are very good. Another thing is sometimes they have to travel or they don't have time. So here I will advise many of the preparations don't get spoiled even if they are kept in the box for 15 days, like besan if it is fried, and panjiri what we in Indian tradition call, if that is kept ready with the, if the you want to put the sugar, it can be crushed and put in that. This besan preparation I will specially emphasizing in the mother stage because it doesn't get spoiled even after 15 days. So even the dry besan which is cooked at home and kept in a box, if you just heat it, it becomes soft, and if you just put it in the milk, it becomes a very good halwa, and that is easier to prepare and does not take more than 3 minutes. You just heat up the milk, put in some besan, and ready to eat milk is there. So these are the things which, and baki rest of the preparations, what Indians are consuming, as I've told you, whether it's a curd or a custard. Another misconception is thanda food and garam food. Most of the in the winter season they will deny the child the curd, the banana, and so many other things. Here again, I will emphasize curd, if it is kept at the room temperature, it's not thanda. You can give it to the child, you can mix it with little bit of salt or sugar also. Same is case with the banana. You can give a mashed banana, you can give a mashed potato, and you can give mashed lauki, kaddu. So many green vegetables which we cook, you just mash it up, and after 6 months, even if you give it to the child will be able to take it and digest it. If the need for water, as I already have emphasized, should be given.
Yeah, thank you, Dr. Bajaj, for sharing your valuable insights on this critical aspect of pediatric care. Your expertise brings clarity to this important topic, and we truly appreciate your time and knowledge. Thank you so much for joining.
Thank you, Dr. Arshita, and thank you for giving me this opportunity to share my thoughts. Thank you very much.
Thank you, Doctor. And to our esteemed audience, we also want to express our gratitude for joining us today. Before we say goodbye, I encourage you to explore our MedSynapse platform. It offers a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until we meet again, take care and keep advancing in your medical journey. Thank you.